I'd like to read from you an excerpt from this article entitled "The Doctor is Not In," on the managed failure of managed care. 2,300 Massachusetts physicians in December of last year signed a despairing manifesto in the Journal of the American Medical Association. And I quote, "The time we are allowed to spend with the sick shrinks under the pressure to increase throughput, as though we were dealing with industrial commodities rather than afflicted human beings. Physicians and nurses are being prodded by threats and bribes to abdicate allegiance to patients and to shun the sickest, who may be unprofitable. Some of us risk being fired or delisted, forgiven, or even discussing expensive services, and many are offered bonuses for minimizing care." Ladies and gentlemen, this manifesto points only in one direction. And that direction is that we need to move toward prevention in the world on a global basis.
We were charged with discussing the concept of new medicine with you, and really what new medicine means is old medicine is broke. Broke two ways. It's broke in and it has no money. And the reason is because our technology is advanced to the point that we can help the very sick very well at a very high price. And that system is no longer working.
I think any Western physician has to realize that something is very wrong in our country. We are getting sicker and sicker with less things that we can use to remedy ourselves and things that can be very harmful. The situation is that we are not diagnosing cancer better, we're diagnosing it more. We're suffering from premature aging in our joints and in our heart arteries. In fact, we're the 43rd healthiest country in the world by the World Health Organization. Japan is number one, and that reason is they spend the vast majority of the healthcare dollars on prevention. And that's what we need to focus on, prevention, not intervention.
I'm Bob Schreckengust. I'm an obstetrician. I'm chairman of the Department of OB/GYN at Mercy Hospital in Scranton. I'm also past president of an organization called the Flying Physicians Association. And what happened while I was traveling around the country with the Flying Physicians, I started to realize that with managed care and insurance companies, physicians' incomes were going down. I knew physicians in California that were actually what I would call unemployed, and they were leaving the state and moving elsewhere. And although managed care hasn't hit Scranton strongly yet, I could see the picture of what was happening. I also, because of the medical legal climate in medicine, realized the stresses were getting to the point that I did not want to do that forever. And I had a goal to retire at 55, but I also knew that I could not retire at 55 and maintain my lifestyle without some alternative source of income. And fortunately, Nick Hanton came along about the same time as I was going through this thought process, and I realized that I could replace my medical income in a few short years and retire and still maintain my lifestyle without getting into my pension plan. So that was my why. A why that's really happened since I've been into it is I really got in touch with my emotions. When you can add value to people's lives, not only physically but also financially, you can't help but get an emotional high, and I've never had such emotional highs as I get with this.
There and welcome. I'm Bob Proctor.
For 38 years, I have worked with major corporations worldwide, from Asia to America. And around 10 years ago, I was introduced by Botanis to Nikan. And when I looked at it, I wasn't really for it because I wasn't pro-network marketing. And he asked me a few questions. He asked me if I understood it, and I said, of course. And he said, could you explain it? And I couldn't. And for years, I have taught people in seminars that you don't understand anything until you can explain it to someone else so that they understand it. So it was obvious I was caught in my own trap. I did not understand it. So I started to study it. And then I started to study the products. And I was absolutely fascinated with what I found. Worldwide, this company has attracted some of the most phenomenal people. Doctors, lawyers, accountants. Then they have truck drivers, secretaries, housewives. So you've got a cross-section of people that they come from all over, and yet they're all finding what they're looking for in this company. The company's got the products, they've got the marketing plan, And they've got the compensation plan that enables a person to enjoy time and money freedom. And in the 38 years I've worked with many of Fortune 500 companies, I have to say that I have been more fascinated and more impressed with NECANN from a corporate perspective than any company I've ever worked with. Now, when I say that, I've worked with a lot of good companies, and I couldn't put those companies down, but none of them were as focused on helping the people realize their dreams as NECANN is. And I find that everywhere I go in the company. You know, a lot of people have trouble with network marketing. They should get over it. And I think they will get over it by understanding it. Because I believe network marketing is definitely the distribution system that's ushering in the new economy. We're not living in the world we grew up in. And the world that we're living in today is a totally different world. In the corporate world, the higher a person goes, the more money they earn. However, the more responsibility they take on and the less time they have for the things that really become important as you get a little older, like being with your family or taking the trips that you've always dreamed of. In network marketing, it's the complete opposite to the corporate world. The higher you go, the more money you earn, the more time you have, and the less responsibility you have. It's a bit of a phenomena, and if a person doesn't take the time to study it, they would miss it. I really believe if network marketing didn't exist, somebody would have to invent it, because it is without question a system for marketing that enables people to truly live their dreams. And that's a big statement. That's for any person to live.
Medicine is changing. It's a paradigm shift in terms of disease treatment to disease prevention. The opportunity doctors had 20 years ago treating disease is the opportunity we have in NECANN preventing disease. The magnitude of what they did is the magnitude of what we can do now.
We are in the midst of a new era of medicine. And this medicine has to do with health. It has to do with optimizing the things we have and living as well as we can.
For instance, right now, I'm impacting maybe hundreds of people at this very moment with products that they're using on a daily basis. To me, that's exciting. Also, from the business perspective, I saw a way for me. I was working harder for less, and that's why it wasn't fun. I love the patients, I love the human interaction, but it just wasn't fun anymore. And now, for instance, I have a 4-week vacation scheduled with my children in August. There was never a way I could ever think of doing that in podiatric medicine. So it's an exciting way. It was an exciting way for me to still stay in the health field, but impact people in a more profound way.
Had been presented to us through allopathic medicine, through traditional medicine, these technologies would be hailed as the greatest miracle in modern medicine today.
I've used these products with hundreds and hundreds of patients with what I think are near miraculous results in many cases, often with people where I had nothing to offer them in standard medicine.
Now, never in my wildest dreams could you tell me that I would be in a multi-level marketing organization a couple of years ago. I said, you're crazy. I never thought I'd do any other business than medicine. But then I started seeing the power in it, and not just the financial power, but the power to affect so many lives. My influence that I can have on people one-on-one in the office is really very small. When I realized the vehicle that we have here and the whole business, the whole concept of leveraging your time and the multi-level marketing aspect of affecting so many lives has just been tremendous. It's just really been wonderful.
I have helped hundreds of people, probably close to 1,000 in the last couple of years, through these wonderful products that we have. A week does not go by, and almost a day does not go by in my office that someone doesn't call me to thank me for how they've been helped. I cannot explain the gratification and the feeling that one gets. We've been hugged, kissed, and blessed through these products.
This company is all about humans being more. It's about it with the products, it's about it with the financial opportunity, it's about it with the philosophy and how you all behave towards each other, towards your friends, towards your cross line. This is going to change the way we take care of each other. It's going to change the way people take care of each other in the world. I'm very proud to be part of this business.
Bob Purdy, podiatrist. I attended the University of Louisville, the Ohio College of Podiatric Medicine, did my residency at the Foot Clinic of Youngstown, and I'm currently president of the American Academy of Podiatric Practice Management. I'm often asked by other physicians, and that is, how could I leave one of the largest podiatric practices in Ohio, very comfortable, very successful, and do this full time? The answer is that sometimes, you reach those points in your life where you really have to put your money where your mouth is, and you have to have a belief. And my belief, by the time I retired almost 2 years ago, in these products and in the company and in network marketing and in the vision of this company was so strong that I couldn't do anything other than what I did. And
do work against pain has long been controversial, up until this medical study at TIER by Baylor College of Medicine.
I was skeptic as anybody else, and I think we have provided scientific evidence through a double-blind controlled study.
Dr. Valbona's study found that 76% of post-polio patients who wore an active magnet increase in pain.
A good many of them, it dropped from high to 0. The first one he put on me, I did feel warmth in my arm.
Today was Jess Summers' first time to test the magnets.
I was glad to try it because everything else that you try has side effects.
After 45 minutes, he says he could turn his neck without pain.
It made a radical amount of difference, yes, ma'am.
Can magnets relieve chronic pain? More and more people seem to think so. Joining us this morning, Dr. Julian Whitaker. He's co-author of a new book. It's called The Pain Relief Breakthrough, in which he claims magnets can help ease the pain of backaches, arthritis, menstrual cramps, and more. And I read your book, but I also read a ton of research by lots of other people who really believe this works.
I don't think there's any question that it works. Magnets have been around for centuries, but only recently have they truly been adopted by segments of the population with real results. There are 20 professional golfers now that are using magnets that allow them to play. And there was one that was he's one of the top money winners. He was going to retire in 1994. He started putting magnets on his body.
Wow.
And now he is the top money winner for the last 2 years.
T.T. Rodriguez, I read, started sleeping on a mattress pad with magnets in it 30 years ago after finding it in Japan.
That's right.
And swears by it.
Yeah, I sleep on a mattress pad. I have a magnet thing. But you see, the reality is, and what we try to point out in the book, is that magnet therapy is, number one, safe, and it truly does work. Now, they're going to be saying, well, then he said, we have cited 80 medical references, scientific references on the theory of magnets and on how they work, etc.
Today on the Dr. Oz Show, you don't have to live in agony anymore. Heal your chronic pain. No pills, no surgery.
Today, we are changing the practice of medicine.
The new invisible treatment your doctor hasn't heard of.
It builds a magnetic field around you, going deep into your body.
Is this the revolutionary cure you've been waiting for?
Are these things for real?
This is new cutting-edge research.
Dr. Oz investigates.
This is how we're going to change medicine. I am more excited about this show than any other we have done this season, because today we are changing the practice of medicine, and you get the help. Now, if you've tried everything to ease your back pain, your neck pain, foot pain, arthritis pain, then this is the show for you. There's a revolutionary cure for pain that few doctors know about, because it's not a new pill or surgery. It uses moving magnets, energy waves that change the way your body copes with pain. Wait till you see what we found. You may not realize it, and you certainly can't feel it, but inside each of us is a raging electrical storm. A biological whirlwind that controls every cell, every nerve, every muscle, every thought. How you experience pleasure, and even how you experience pain. What if you could harness this powerful force field inside of you to feel better, sleep longer, and most miraculous of all, ease your chronic aches and pains?
That's the promise of magnetic therapy, which uses the power of magnetic energy to redirect electrical impulses to the areas where you feel pain, so relief and healing can begin. The FDA has already cleared pulsed magnetic therapy for fusing broken bones, treating severe untreatable depression, and now to treat postoperative pain and swelling. It sounds like science fiction, but is magnetic therapy for real? Are we finally on the brink of a whole new frontier to reduce, even erase, your pain?
Now, just to be clear, we are not talking about static magnets like the kind you stick on the fridge. This is pulsed electromagnetic fields. It's pulsing moving energy. So Dr. James Dillard is a world-class pain specialist who practiced at being at New York Presbyterian Hospital for many years. So Dr. Dillard, are these things for real? I mean, how can magnetic therapies help ease pain?
Because the electromagnets actually affect the nerve cells. Nerve cells are electrical cells, and the magnetic fields can actually affect how the nerves fire and quiet them down without using drugs that most people are used to, and increase circulation in the area and aid the healing.
You take care of a lot of patients. When folks come to you and they want medications or surgery or needles, how do you convince them that magnets might be a better solution?
Well, I actually don't have to convince a lot of these people. A lot of my pain patients, they're sick of having too much morphine, oxycodone. They're sick of all the injections. And I'm trained to do that too. Many of my patients, and remember, more than 1 out of every 3 Americans is suffering with chronic pain now. 1 out of every 3. Many of my patients want to try something other than drugs, unnecessary surgeries, damaging surgeries, and these deep injections. So a lot of patients, I don't actually have to convince them. They want to try something else.
All right, so this
I was in less pain from just one treatment. I woke up the next day and I started hitting it 3 times a day. Within 6 to 8 weeks, the pain was gone. I have no pain today at all.
So what, Mike, welcome to the show. So how is life different now that you try these magnetic therapies?
It's tremendously different. Pain-free completely.
You're kidding me.
No.
I mean, describe your pain before this all started.
It was intense. I'd be laying on the floor with ice packs, seeing doctors, seeing chiropractors. Then the pain just got so bad that I needed to look into something else.
And did you talk to your doctor about it?
I talked to, actually I talked to him. No, actually I didn't. I didn't talk to him. I was...
Why were you hesitating? Were you embarrassed about not talking to your doctor?
A little bit, yeah, I think I was.
This is, for me, the biggest point of this show.
Yeah.
I don't want you ever embarrassed if you find something that works for you, just because we didn't know about it. I made a big promise to you folks when we started the program. I said, we're going to change medicine today. This is a novel idea, and I'm proud that we're able to uncover it and describe it to you guys, but what's going to change medicine is not me talking about it. It's going to be you not being embarrassed to talk to the folks that are governing you in terms of your health, that are giving you advice, that are trying to heal you. You need to tell your doctor. Do you know why? Because every other patient that doctor sees is going to benefit because you were willing to put your hand up and say, you know what? I was having bad pain. I wasn't getting relief. The medications, the injections, the operations, they weren't working for me. I want to try this new therapy out. And you know what? It worked for me. Please share it with other people. That's how we learn in medicine. I'm asking you to help us. I'm asking all of you to play a role in improving the care we give you. If you go back to your doctor and tell them you did this and it helped you, they're going to be curious about